Hi, my name is Dr. Jamie Harrow, physical therapist and owner of Smart PT here in California. I work primarily with adult athletes in an outpatient orthopedic setting, and I wanted to take a minute to explain my experience using the Lafayette instrument handheld dynamometer, as well as provide a little context for why I think its use is so important in clinical practice. A common part of a physical therapy exam is the determination of strength in various muscles. Traditionally, this is done utilizing manual muscle testing, using the hands of the therapist against resistance to determine the strength that the muscle can generate. While this has been used for years, numerous studies have shown that it is not a very reliable method of determining differences side to side, as well as overall strength capacity of the muscle. This is especially true if the muscle that you're testing is going to be operating anywhere near what we might consider the healthy range for a normal adult. As much as we clinicians like to think of ourselves as perfect measuring devices, it just isn't true, and relying on those measurements can put our clinical recommendations at risk. That's where these tools come in. Handheld dynamometers help to limit the personal bias that can enter the equation. They're very easy to use and integrate into your pre-existing clinical flow. Now I'll demonstrate its use for a few common muscle testing positions. Now we're going to test some of the muscles in your arm. I'm going to put you in a certain position. I'm going to rest this device against part of your arm. When we start, you're going to hear a beep. I want you to push as hard as you can into me. Then when the test is done, you'll hear another series of beeps, and then you can relax. If at any point you feel any pain, just stop immediately, okay? Okay, so sit up nice and tall. Arm, have you put it right up here. I'm going to brace your shoulder right here. I'm going to put the device right here, okay? You ready? Push into me. Good. Go, go. Push, push, push. Good. Good. And go. Okay, let's do the other side. Remember, there's nothing new to learn here. Just utilize the manual muscle testing positions you're familiar with and use the dynamometer in between your hand and the point of resistance. The clinician's body position, points of contact, patient positioning, they can all remain the same. The Lafayette device has a unique benefit I'd like to highlight. The digital readout not only shows the peak force, but also a graph of that force over time. This has proven extremely useful clinically, as it helps me work with patients to have them visualize pain onset points, weakness, and motor control discrepancies. So here's your right arm, 20.3 pounds, and you can see that the force was generated pretty consistently along the graph. And here's your left arm, 16.4 pounds, and look at the ups and the downs along the graph. It shows that that force was generated very inconsistently by the muscles. I'm very excited about the integration of handheld dynamometry into clinical practice. Anything that takes the guesswork out of determining a patient's deficits seems like the right direction to go, and this technology is so easy to integrate into your pre-existing clinical flow. I hope you've enjoyed learning a little more about